Hi, I'm Dr. Munshi. In this video, I'll talk about what is RCT. The full form of RCT is root canal treatment. What is root? The part of the tooth that is present inside bone that we are not able to see is root, and the part of the tooth that is present outside the bone that we are able to see, that is visible, that is the crown part. Now, if you consider this is a tooth, the part that is present inside bone that we are not able to see is root, and the part that we are able to see, that is crown. Why I use different color here? Because I will discuss different layers of tooth now. That will help you understand what is RCT. So if you consider the part is crown part and this part is root part, the outer layer, outer hard layer is enamel in crown. If this is crown, the outer part, outer red part, black part is your enamel. And if you consider this is root and the black part is cementum. So the black part that is present in crown is enamel and the black part that is present in root is cementum. Both the layer is hard. Now the second layer that is present inside enamel, inner part of tooth, the green portion, that is dentin. That is also hard part. That is also hard part. You are able to see the green part in the crown portion as well as in the root portion. Dentin is present in crown also and root also. So this is dentin, this is enamel, this is dentin. Now you are able to see the red part, that is the soft tissue part. This part is soft, this part is soft. It contains cells, it contains nerve, it contains blood vessels, that is arteries, veins, capillaries. So this part, this pulp, this portion is called pulp. Only the pulp portion of the tooth is soft. Other part, enamel, dentin, cementum, all this is hard part. So when you need RCT, I'll discuss these things before I proceed on what is RCT. Now when your carriage starts or cavity starts, it starts from the enamel because this is the outer part, enamel. So when the cavity is in enamel, will not feel any pain because the enamel is not consists of nerve is present here. Anything what will irritate this pulp will create pain because the pulp part is consists of nerve also. So cavity starts in enamel, there will be no pain. Then it will come to the dentin layer. That green layer is dentin layer. You can feel little bit sensitivity because you are approaching towards pulp. Pulp is a sensitive part. Now if you don't treat that, if you didn't treat it, this part, this cavity, the cavity will go and touch the nerve, that will touch the pulp, and pulp will got infected now. So pulp will create tremendous pain. And if this is chronic situation, pulp is completely affected and injured, and by the time after 2 months, 3 months, 4 months or 1 year, if you are not treated that part, the pulp will pulp may become dead tissue also. So when your pulp got injured, the cavity approached to the pulp and pulp got injured, you are suffering from many days, many months, you need RCT if the cavity is reasonable. But if all the tooth is affected and no hard part is present, then you need extraction. But when it touches the pulp and the damage is not that much, that means damage is not greater than the half part of the tooth, then it can be saved. So these fundamental things you have to understand when you need RCT. Now I will discuss in this part what is RCT. RCT is just making a hole to approach to the pulp. Just suppose your carious cavity affected the pulp, it touches the pulp. So all the pulp got affected, infection. Okay. Next, what you have to do, what dentist will do, dentist will make a hole like that. Make a hole. This part will remove by dentist, and dentist will create a path to reach the pulp. Dentist will insert instruments to remove the red part because it is affected. This is RCT, root canal treatment. By removing the pulp entirely and cleaning the inside area, cleaning this pulp chamber or pulp, this portion completely, the innermost portion, soft tissue portion, the soft tissue need to remove because it is affected, and it will be removed by file. Different instruments is there, that instruments will remove it mechanically. Cleaning will be done by instrument as well as different solution. So that is the main fundamental thing of RCT. And after removing that part, these portions will be filled by a filling material is called gutta percha. After filling this portion with gutta percha, the hollow portion that was created by dentist will restored by material, dental material, different material is there. And this is the whole process. This is the complete process of RCT. So in one line, RCT is removing pulp and replacing by gutta percha. Thank you very much. Hope this video will help you.